So good afternoon, everyone. My name is Linda Foley, and I'm the Executive Director for Home Health, End-of-Life Care with Fraser Health. And I'm going to talk about home care, the big basket of services. So Susan Brown, thank you very much for your earlier discussion. We've heard a lot about home support today. They are absolutely, as Bob and Ed have discussed, the backbone of our organization and the backbone of our service. But they're one service in our community. And currently, I'll just to let you know, in Fraser Health, I have under me 1,700 staff. Of that 1,700 staff, 500 are RN, LPN, 150 are allied health services, a combination of social work, PT, OT, RT, respiratory therapists, 250 case managers who are a compilation of many other professional designations, and 800 home support workers. But I also partner with 4 very large home support agencies and across the Lower Mainland in partnership with Vancouver Coastal, and within Fraser Health with my partners in home support. Last year we delivered over 2 million hours of home support, 240,000 professional visits, and continues to increase. You guys are on the cutting edge of an industry that is actually starting to flex its muscles. I've been in this industry for almost 15 years, and it's about time. So I'm going to talk to you today as leaders in the organization and about the challenges that we're seeing within our human resource domain, and I mean home care, the big picture, because it doesn't matter if we talk about home support, or we talk about our RNs or our LPNs. The issue really to me today is an intergenerational workforce. And our ability to provide access to high quality, effective, patient-centered, and safe home care services is critical and depends on the right mix of healthcare providers, the right skill set, in the right place at the right time. And we need to plan now, because seriously, if we don't and we're not prepared, we are going to see, you guys have all heard the demographics, big tsunami coming. Okay, so I won't dwell too much on the societal issues, because I know you've heard a lot about this within the context of home care. We really know across this country that our healthcare system, period, is facing sustainability and capacity challenges related to the demographics we're seeing, the incidence of chronicity in society. In British Columbia, 40% of British Columbians have chronic illness. That isn't a nice stat to be reporting. And basically, we have growing populations. And this isn't unique to BC. We are seeing this right across the country. And within Fraser Health, on average, I can let you know, and I'm sharing, every day we have 260 patients that are in the acute care sector waiting for alternative levels of care because they no longer require acute care. And this group is predominantly our seniors. And in response to this challenge, Fraser Health and the other health authorities are working and believe that we need to have a system-wide approach so that we can ensure timely transitions to the right place for each of our persons in care, with emphasis to support our seniors with their choice to go home. Bob gave us the demographics. It's true. In the stats, we want our seniors home, and that's what they're telling us. They want to be supported at home if that's appropriate for them. Enhanced services will improve the quality of care in the community and primary care. We will be more integrated. And this is where we know right now 80% of the care interactions happen in the community. And basically, this is where healthcare can be influenced the most. So we need to be prepared for this. In the past, home care providers and our primary care physicians across the country have worked separately, and they've not worked in cohesion and collaboratively. This has really created a gap in communication and continuity of our care, and as results, our actual care is disjointed, and often it can be even duplicated, especially for those that you've talked about that have chronic and complex care needs. So there is a big shift on the way. We know that health reformation is critical, and it's upon us, and we're in the middle and starting in that churn. And this big shift is actually going to be moving more service and care out to the community. And we've been working on lots of strategies to assemble the pieces of the Home is Best strategy for about the last couple years. This work is really multi-pronged. It's an integrated approach across the system to create more timely services for our clients in the community, moving them to the right care. We are shifting the system from hospital first to a home first model, and that's going to impact our staff and change the way they practice out in the community. They've been working independently, and they're going to have to move to full collaboration, and they're going to have to move away from that siloed approach into a much more integrated system. And in a nutshell, that means we're going to actually have to have more services and dollars in the community to provide those services, and improving supports in that transition. Because Bob's right, you made that point, the acuity is increasing. So we need to ensure that the transition and the handoff where we have people returning home is well done. So I've given you a bit of the context. So now let's peer through the lens of what we've been talking about today, and that's our human health resources in the community. People are the healthcare system's greatest asset. Most healthcare organizations today have a mixture of generations within their workplace, and I know that's indicative of across the country because I see it every day in the work that I do. Today in Fraser Health, the mean age of our home care staff, that's taking in all our staff, including home support workers, RNs, is 46 years old. And that swing ranges from 22 years old to 66 years old in the community. So right now, what I'm telling you is that we got 4 generations working together. And we are really trying to sell the mantra of having a great workplace. A great workplace, and we want to have a workplace that is diverse, but also we need to ensure that these generations can work together. And therefore, we have to have an intentional focus on generational demographics in our home care organizations, and that's it's essential to our future. We're not going to move forward unless we start thinking about that. Some of the biggest rubs I see in the workplace is related to that. So the facts. People are the single greatest cost to the healthcare system. Between 60 and 80 cents of every dollar spent in Canada on health care is spent on human health resources. In the community, it's actually higher. It actually is more towards that 80-cent mark because we're low tech. And in the acute care sector, it's lower because they happen to have that technology component that has an added cost. But because of that, it's imperative that we manage our greatest assets, which are our people. And to get the most out of our employees, we're all leaders and leaders in this room. We have to understand what each of the generations within our workforce, what brings them to the table, what makes them get up every day, what makes them be the best they can be, and perform at the highest levels they can perform at, and how they interact with those that are around them. So the current reality we know is that you've heard it today, the boomers turned of age. The first cohort aged 65 last year. And across society, they are the largest cohort. In society, the boomers make up 10 million people almost. The first cohort turning 65 can start to retire. Even though our mandatory retirement age is gone, they can start to retire. And within the next decade, every 2 people who are retiring, there'll be less than 1 person to take their place. So it is apropos that we really work hard at understanding what an intergenerational workforce means. There is a real war for talent. We know that, and I'm looking at Susan, among the health authorities, we're stealing back and forth regularly. We do with our home support agencies. This whole war for talent is really, really important on how we attract and retain. And I know Winona's dialogue today about retention was critical, and I really listened, Winona. That retention piece to me is the leverage point that we have. You're right, it's not hard to recruit, it's hard to keep. And so we're really starting to feel the pinch within our organizations. We're faced with this challenge, and it's time to rethink how we plan and how we deliver home care services, the bigger bundle. It's time to really think about designing service delivery models that encourage providers to work collaboratively and to full scope of practice. And I would even say that within our home support realm. As the Canadian home care workforce ages, more generations are starting to work alongside each other. Like I said, I'll be talking a little bit more about the 4 generations in the workforce right now. The knowledge and skills and the workplace attitudes possessed by today's multi-generational workforce present us with a lot of challenges, but they also present us with opportunities as healthcare leaders. So leading and successfully managing this type of workforce is becoming imperative. So our key to success, in my mind, and this is Linda's story, is that as an industry, it requires leadership that clearly understands and can proactively plan for an intergenerational workforce. The effective leadership of an intergenerational workforce should provide quality work environment. We all want to be magnet organizations that attract staff to us. We need to have we have to be respectful of workers that bring differing perspectives and skills to the table, and we need to allow them to grow and to diversify in no way that one single generation can do. So here's the generational divide that we have and the demographics that we're seeing across the country. So the traditionalists, there are parents in my case, but maybe even some of you in the room. And they're numbering about 6.5 million. The boomers, the Generation X, and Gen Y are the generations that I'm seeing in my workforce. A few years ago, the International Center for Teaching and Learning commissioned 2 papers on intergenerational workforce. Avril Henry, in her paper called The Changing Faces of the Workforce and Intergenerational Impacts, focused on the shifts occurring in how organizations need to think about attracting and retaining employees, especially those designated as belonging to the Gen X and Gen Y. And Henry examined examined what motivators for these generations would be important to employers. So access to learning and development, effective and inspiring leadership, work-life balance, and flexibility are all really important factors to the younger generations. Gen X and Gen Y, they're really interested in learning environments. They're interested in where leadership invests their learning and development, and they need to have access to coaching and mentoring. And they need to have access to technology. They've made that very clear. The second paper that was commissioned was Robert Critchley's paper, The Aging Workforce to Rewire or Rust. He goes on to say that only 3 people working for every 1 person over 65 will be the trend. And basically today we know that's 6 to 1. So today in Canada, every 1 new person entering the labor market, there are 7 workers over the age of 45 that are available in the market to work. So according to Critchley, 80% of the future workforce is actually, over the next 10 years, is going to be your 45 and older. And I think that's true. I can see that. I did orientation today with a whole brand new pile of staff coming into home health, and I bet you across the room, half of them were over the age of 45. There are many ingrained prejudices that we see in society associated with employing older workers, though. And stereotypes abound. I listen to it every day. I happen to be an older worker. So as outlined Critchley's work, older workers have a lot to offer, providing a wider skill base. They have broader experience and wisdom, and they have a solid work ethic and flexibility. He states that employers that need to recognize that older workers are still capable of working in most roles into their 60s, but I do recognize, Bob, what we need to have is truly a safe work environment, and that meaning technology in the home that's going to provide safety for our older workers. We also know that there are generational perspectives and perceptions that are shaped by when you were born. And these perceptions are important dimensions to our workplace culture. How different groups of workers work within a team or within an organization, or see each other or see themselves, has a major impact on an organization and the services and the care we deliver. We need to really shift to a positive perception, because we know that can promote workplace cohesion. Teamwork, innovation, and performance are basically hindered by negative perspective. So as leaders, I challenge you, we need to understand and manage the differences, the perceptions, and the perspectives across our system, so that we basically are all on the same page. Leaders can begin to foster an understanding and inclusion among the generations by providing flexible working arrangements that fit the different needs of individual workers. And by applying some principles like this of organizational effectiveness, leaders can derive the full benefit of a multi-generational workforce. There are many enabling structures we can build, and leadership is responsible for the development of these structures and strategies that will respond to an integrated working and learning environment and culture. Home care organizations planning for a workforce of the future need to understand what key motivators are for each of our generations. Awareness of the differing values, experiences, styles, and attitudes are the first step. You need to understand what makes people get all excited and come to work every day. Adapting our leadership style is absolutely critical, and we need to meet the needs of our staff that will help manage and retain that workforce. And leaders need to develop engaging tools that will value each generation and implement strategies to create a workplace culture that ensures a highly engaged group of staff. We know that a real fact, retaining staff, I've heard it today in many of the presentations, is tough. And retaining staff in home care can be an agonizing process when we have staff turnover before we actually know that we've added value and we've recouped the cost of training and recruitment. So in the home care sector, skilled nurses, and I'm talking now about our RNs and LPNs, of all ages are trading job security for mobility. I'm seeing it, and I'm absolutely amazed by it. But our young nurses are leading the charge. They're moving from one organization to the next, soaking up training resources and competing to prove their ability and their value. And this is relatively a new phenomenon across the system. And as leaders, I challenge you, we need to foster a culture of positive interaction in that intergenerational workplace. We need to create productive teams that include an interdisciplinary team approach. It's not home support, it's all of us. It's a much more wraparound service for our client, and that partnership also includes our physicians. No one-size solution will fit all. We basically know that we need to create a friendly work environment, and there's lots of strategies out there. And we do need to understand the generations' different expectations in the workplace, their career aspirations to teamwork, how does that fit with them, how they respond to leadership, work tools, whatever we can do to get them back into the door every day. Okay, so there are some major trends in the literature that I want to end with, and basically it's not all about money, because I know, and the literature is telling us, and I'm hearing from my staff, a sense of purpose and fair compensation is required, but it's not the almighty dollar. Although I absolutely want parity across the system, and I know that we don't have that in home support, nor do we have it for most of our community workers if they're RN, LPN, OT, PT. There's a disparity across the system. So our staff are telling us they want recognition, acknowledgement, and rewards, but not monetarily. They want career development. They want opportunities to learn. They want great leadership. They want connection with their leaders. They want work-life balance. They want healthy relationships at work. And job security is a priority for the boomers and the traditionalists, but not so much for the Gen Y and Gen X. And they're basically got a different loyalty and more to themselves, and that's not a critical thing. So we basically, as employers, all need to work hard and smart and find balance in our work environments for all generations to fit at the table. We also know that in order to attract retain, and engage our employees, it really becomes our responsibility as leaders. And here are just a few of the things that I've thought about through to share with you. We need to ensure people have coaches and mentors who care about them. And I know we have mentorship programs across with many of our professionals, and I believe that's really important in our home support workers too. We need to develop an environment that empowers our employees to work more in that team-based environment, and they need to work together, and they basically need to relate the goals and have better respect for each other. They basically need to be surrounded they need to surround each other with talented people, and their co-workers are talented people. They have to have similar drive for quality, and the quality is always about that patient or client or resident centeredness. So we need to create flexibility in schedules, and we've heard a lot about scheduling today from the home support world, because really quality of life is critical for all our employees, and flexing some of those work schedules to accommodate families are really important. We need to help bridge the communication gap, and we've heard a lot about communication. Our roles as leaders is to prevent the misunderstandings in the work and to ensure that we have a healthy work environment and help facilitate those sometimes uncomfortable but crucial conversations. Get your employees to develop better listening skills, because they need to confront each other and hear each other. Sometimes that generational divide becomes a rift, and we don't want that to happen. So customize work where possible in order to engage all our employees, and delegate in ways that will bring out enthusiasm and strengthen the team. So as our loyalties continue to shift, so must our leadership styles and skills. We're now working with employees who actually question authority, and they evaluate leadership, and they evaluate who they want to work for. So how do we keep the diverse group committed to the job and the company while respecting their differences? Focus on goals. And again, I can't stress that enough. The goal is about delivering quality care and service. And make everyone feel included. Keep an open mind, ignore age, encourage each generation to mentor each other. Even our younger employees have a lot to offer. Break down the bonds of tradition. Invest in talent, have talented workers, then work towards giving everyone equal footing. Show them the future. As a leader, it's your role to demonstrate where we're headed and where we're going and how to prepare for that. And basically, little changes make big differences. Good people leave bad bosses, not bad companies. So today's workplace requires a more collaborative type of leadership. And build it, and they will come. You have that vision, you have that perspective, they will come. They will want to work for you. So in closing, I hope I've provided a quick overview of the human resource challenges that are facing our sector, but also some opportunity to leverage and how we might move into the future. Leadership's role in today's complex home care environment, they're tough, and I get that, and I know that. But great leadership is even tougher. It's tougher work, but the effort is worth every penny of it to us, because in my mind, it leads to better quality of work life, better patient, client, and resident care. And as a final word, I'd like to just leave you with a quote from Harvey Firestone: the growth and development of people is the highest calling of leadership. So thank you.